Welcome to Care Teen Conversation Podcast, sponsored by Curbell Medical, featuring clinical leader and fall prevention and patient safety awareness expert, Dr. Patricia Quigley. This episode, Dr. Quigley speaks with guest Maureen Musto, a rehabilitation clinical nurse specialist for Ohio State Dodd Rehabilitation Hospital and board member for Association of Rehabilitation Nurses. Maureen also was one of two nurses appointed to take part of the World Health Organization's package of interventions for traumatic brain injury Rehabilitation Development Group.
Ladies and gentlemen, I am so delighted that you have joined us today to listen, and every day, and as many times as you want to listen to this podcast with my dear friend and colleague, Miss Maureen Musto. I would like to just share with you that as I get to introduce Maureen Musto as a rehabilitation clinical nurse specialist, that she is one of the most extraordinary rehabilitation clinical nurse specialists that I've been able to work with in my career. I know that many of you know me. I'm a rehabilitation clinical nurse specialist myself for so many years, but throughout my career, I've gotten to meet extraordinary nurses. And one of my extraordinary nurses is my dear friend that's joining us today, Maureen Musto, to talk with you about her journey in rehabilitation nursing, but to also help move you into your fall prevention programs in different ways. And I'm most excited to be able to help her share with you her influence in traumatic brain injury management, not at a national level, but also at an international level. So colleagues, I'm delighted to help Maureen Musto, who again is a rehabilitation clinical nurse specialist, practicing at Dodd Rehabilitation Hospital with Wexner Medical Center at the Ohio State University Medical Center in Columbus, Ohio. Maureen, I cannot tell you how excited I am for us to be able to be together on this podcast and for me to be able to introduce you to so many people through this podcast. Please share with our audience a little bit about yourself.
Well, thank you, Pat, for such a wonderful introduction. It was very touching, and say that meeting Pat has been just such an inspiration to me too, and her energy that she brings to rehabilitation nursing and to nursing in general. So I am pleased as all can be to be part of this podcast. Just to tell a little bit about me and my background, I am from the farmlands of Ohio and read an article on rehabilitation when I was a kid, and I thought, this is what I want to do. And I went to Columbus and attended the Ohio State University College of Nursing. And as luck would hold it, my first clinical was at the rehab center at Ohio State, and I fell in love. So when I got the chance to be a student nurse, I applied and got a job. And as luck would have it, I was on the brain injury unit. I started my career in brain injury, and I loved practicing nursing at the bedside. I enjoyed seeing patients advance through the continuum of the care, from when they come in and they're very debilitated, to where you could wean out trachs and get them off tube feeding and teaching them how to walk and talk and eat and all those good things that we do. As I was there, the clinical nurse specialist that was at that really inspired me and got me involved in our professional organization at a local level. So I've been involved with that pretty much since I started in nursing, and then was certified as a rehabilitation nurse when I was eligible at the 2-year mark. I thought I was going to have a career at the bedside, and lo and behold, when I found out our clinical nurse specialist was going to retire, I went back to school. So that was great. I went back to school. I was able to do clinical with Cindy Gatens. She was a founding member of our local chapter and national chapter, and just was an inspiration that I was able to take her cohort, Norma Clannon, who is also a founding member of our national and local chapter. And Norma is a fellow with us in the Association of Rehab Nurses. So I've had very inspiring people in my life throughout my career that I have been able to reach this role. And Stephanie Vaughn was one of our chapter presidents at our local level. And then she became our president at the national level. She got me involved at the national level, and I became involved with chapter book reviews to writing test questions for the certification exam. And then she finally asked me would I consider running for the board of directors. So here I am. I'm on the board of directors and led to other opportunities from working with chapter support and working with the World Health Organization. So I sit here today kind of humbled that from my beginnings of being a floor nurse to working my way up to being on the board of directors and even working with the World Health Organization.
You know, Maureen, it's so exciting to listen to your career trajectory. And I know that as people entered into this podcast, they saw your many credentials. And as we talked now about the professional organization that you're such a leader in, that is the Association of Rehabilitation Nurses. Your chapter in Ohio is one of the longest running chapters. But let me just share with all of our audience the extraordinary credentials that you have been able to achieve in rehabilitation nursing. You're an advanced practice registered nurse, clinical nurse specialist. You're also a board certified advanced clinical nurse specialist, and you're certified as a rehabilitation registered nurse. Maureen, what do those credentials mean to you as you represent the Association of Rehabilitation Nurses across this great country and internationally?
Well, it really validates the expertise that we have as a rehabilitation nurse. You know, having that recognition from your professional organizations, it gives confidence to not only the staff that you know what you're talking about, but I also think that patients recognize that, or the public recognizes the value and how much you care about your profession. It shows that you care about your profession, that you want to promote your profession and advance the care that your patients receive.
And you know, that is just so important to share with everyone, because these are credentials that really help demonstrate to everyone your level of expertise. And I'm very proud to share with everyone that's getting to listen and meet you today, Maureen, through this podcast, is that you were just recently inducted just this past year in November of 2021 as a fellow in the Association of Rehabilitation Nurses. That is such an extraordinary achievement that very few nurses have achieved within the rehabilitation nursing specialty. And I am proud to say that as my friend and colleague, that I was one of your sponsors for you to become a fellow. Yes. But what does that how does that help you to be able to stand out with others within the rehabilitation nursing specialty?
First, I want to say that the fellowship is a select group of individuals with advanced degrees who give back to the community and have shown their worth in being rehabilitation nurses, and that we have mentored our staff, published research, worked with our professional organization to advance rehabilitation nursing. And we have a commitment. It's not only that you've made an accomplishment, this is something that goes forward, that we have pledged that we are going to continue to promote rehabilitation nursing. And I'm hoping as we pull this group of fellows together that we can really promote rehab nursing and pull more and engage more rehab nurses from the bedside to be more active in rehabilitation nursing.
Well, Maureen, you are absolutely to be applauded, because it is indeed a Lifetime Achievement Award, knowing that you have so much more to give to rehabilitation nursing. So congratulations on all of your accomplishments. And, you know, as you and I have worked together over the years, a part of what really drew us together is our commitment to fall and fall injury prevention program as rehabilitation nurses. You know, Maureen, I know that you share with me that many times within organizations, rehabilitation settings, that we kind of dealt with the same dilemma, that falls were accepted to be part of our culture. And you and I really did not agree with that. We knew that falls were preventable and there was more that we could do to help reduce the risks of falls. So that's really too, besides our specialty and our love for rehabilitation nursing, of how you and I really connected. So I'd love for you to share with our audience, as they learn even more about your specialty, is what are your top 3 fall prevention initiatives that you have launched in your rehab center and your success? Could you share a little bit about that with our listeners?
Sure. And I just want to start out thinking, when you're thinking about fall prevention, you got to really know what is causing your falls. So really doing a focused analysis and reviewing your falls and really doing that root cause analysis to figure out what your falls are and focus on that area. It is multifactorial. The top 3, 4, 5 things that I say, you can't just do one of them and it's going to prevent falls. You have to do a multifactorial approach. One of the big things that I find is falls happen a lot of times associated with toileting. Having that individualized toileting program. I worked with brain injury a lot, so knowing the types of bladder dysfunction that a brain injury would have. So understanding bowel and bladder and how those mechanisms can affect falls, knowing that the frontal lobe might be affected and the awareness, the need to even void could be affected in that brain injury. So having those time scheduled voids is imperative. In the rehab world, we're scheduled through the therapy day, and we got to schedule those times to avoid, breaking it out into the evening and the off hours to also schedule. Think about cutting back some fluids in the evening so people aren't waking up and getting impulsive and jumping up out of bed. So you have to look at that 24-hour picture and time their voids.
You know what I'd like to share as well, Maureen, is that's really hard work, isn't it?
It is.
Getting the nursing staff, everybody to hardwire those toileting schedules and making sure those who really need help to get toileted, actually it really gets achieved. And I know that you've spent so much time on that. That's really hard work implementing at the point of care 24/7, isn't it?
Yes. And I want to say utilize our electronic documentation because you really can see we're charting every time someone's continent and incontinent. So you can get into the chart and figure out their pattern. So if you can figure out that someone is incontinent every day at 10 a.m., then by golly, we need to schedule a time void at 9:30 in the morning. And then review those patterns and empower the nurses to look at the patterns. It's right there in their chart, that 24-hour period before. And if you see a pattern where they're not going every day like say you got a toileting time at 11 and they never go at that time, don't take them that time. Take them when they're having the issues. Utilize our electronic documentation, utilize our scheduling. We actually have scheduled, we have PT and OT on our thing. We put time void on our schedules. Wins that we have, and that trumps everything, but time voiding can be part of therapy. Transferring on and off the toilet, doing hygiene as part of therapy. Those time voids can be worked into the therapy schedule.
Oh, I so agree with you, Maureen. I hope others could help really role model what you're doing.
Yeah, I that's one big thing I think really helps us that we do that. We do that pretty well. And then utilizing safe mobility. I mean, we have the ability in the rehab setting to have physical therapy, see our patients, and utilizing their recommendations, but it's a two-way communication because nursing sees the patient on that 24-hour period. So giving the patients recommendations on how to transfer and how to transfer safely and figuring out your communication tools. We've really worked hard with that, and we tweak it continually every 3 to 4 months based on our tracking and following our evaluations of our focused analysis of our falls. And then finally, I want to talk about teach back. Because without having the patient as your partner, I know for patients who have capacity to understand, it may be more difficult. A lot of our patients can understand, but they're overwhelmed. They get a lot of information. And I think it's very important when we talk about these safety initiatives to have that patient repeat back to you what they've learned. So not only what things you want them to use the call aid or you want them to transfer a certain way, having them repeat how to do it, but also making sure that they understand what could happen if they did fall. So making sure they understand that if they did fall and they hit their head, that they could have a hemorrhage, or if they fell in their hip, they could fracture a hip. They need to understand the consequences of what could happen if they didn't follow those recommendations. I think it's very important that patients understand why we're doing what we're doing.
And Maureen, I so agree with you. Teach back is such an important intervention. And I think a lot of times in our organizations is that our interdisciplinary team members, nurses, really underestimate the value of teach back. I, like you, have been such an advocate of this intervention because Teach back involves the cognitive domain of learning. Can they understand and can they tell you back? In the psychomotor skills domain of learning, can they show you back? Can they actually do what we're asking them to do? But people don't really evaluate how effective their teaching is. And I think this is so important because this is how we know whether or not we've done a good job, what they've learned, and what we need to fill in. So I know that this is an intervention that's been around for a long time. So I hope as people listen to this podcast today that you will go back into your organizations and really emphasize the importance of teach back. Because, not all of us are really good teachers, are we, Maureen?
Oh, no, but I think it helps. We wrote out some scripts for our staff too. So not only having our nurses watch a video on how to do it, but, practicing it when they're in orientation with their preceptors. So they get it as part of their routine. It's just like another skill that you do. You just got to practice it. And we gave our tools to patient care associates too, or hospital aides, whatever you call them in your facility, to have a script. So if a patient is asking them, someone who's unsteady or something that can't be left alone in the bathroom, that you need to stay within arm's reach, that we gave them a script of what to say. We're staying with you to keep you safe. They have that script of what to say, and then they escalate it if the patient is insistent. So then the nurse can come back and educate. So I think it's important to keep the whole team involved and having the people who are directly involved with those kind of things.
That is such great guidance to everyone who's listening to you, Maureen, because I know you and I share as experts in rehabilitation, as clinical specialists, is that much of the measure of our success is not whether or not someone fell. The measure of our success is have we been able to mitigate and eliminate their fall risk factors, help them to have the knowledge and skills to be the best that they can be. So if they go home after they leave us and fall, they know how to be able to manage it, right?
Yeah.
They know what to be able to do. Our measure of success is how well they do after they leave us, isn't it?
Yes.
Leave our care.
Yes.
Yeah. Is there anything else you'd like to share about the fall prevention initiatives that you've launched as an expert in rehabilitation, as a clinical nurse specialist, always teaching, guiding?
Well, I want to go back to my brain injury roots and think about behavior management, because I think it's very important that we identify the triggers that make somebody agitated, because I think that's a challenge a lot of places face, is behavior management with somebody who's aggressive. But, if you can identify the triggers and address those, we implement that cognitive behavioral program, and having everybody on board and doing the consistency and following a behavior plan will really help you with preventing falls too. Because if you can manage agitation, it's really a key. And, keeping someone in bed is not necessarily the way. They're less safe in bed than a lot of times if you would just let them get up and transfer. Repetition and modeling safe behaviors and addressing those behavior management issues, I think, is key too.
Oh, I'm so glad you brought us back to the issues surrounding behavior management and agitation, Maureen, because, I know you do, just like I do, get a lot of questions about how do you keep those patients safe who have cognitive impairment. And I tell you, ladies and gentlemen, for those of you listening, is that, it can be done. And patients who have traumatic brain injury, just like those with strokes, can learn if everybody teaches the same way, the same thing time and time again. And that's continuity of care. And that's as much work, as hard work as it is hardwiring a toileting program, isn't it, Maureen?
Yes, it's being consistent and having that communication with your team. So whatever aids that you use to communicate with each other, to make sure that you're addressing these issues in the same way and doing what works. I mean, that's the name of the game, figuring out the triggers and what you can do to address it and what works and what doesn't work.
Yeah, and modifying our care planning as patients progress or sometimes have complications and regress. So thank you so much for your guidance to our audience about your fall prevention initiatives that you've launched. And as you came back to traumatic brain injury, that's a really nice segue for us, Maureen, for me to be able to help shift the great work that you're sharing with everyone. And that's to your expertise in traumatic brain injury. Applauding your clinical expertise, I'd like for you to share with our audience for you to talk about your journey to the World Health Organization and the traumatic brain injury group that you actually got to be a part of as the only nurse, I believe, on this international group, or maybe of two nurses. Is that maybe, am I right? That
Yeah.
and share some examples of what came out of that work. I just think that is so exciting that you got to be on the world stage and launching interventions for TBI, traumatic brain injury.
It came as a surprise. I was asked if I knew anybody who was an expert in traumatic brain injury, and I'm like, well, I've been working in it for over 25 years. So
that's you.
Yeah, that was me. So I was like, that worked out well. So I ended up volunteering. We put in like over 56 hours, probably plus, because there was a lot of, you had to kind of back up what you were saying with evidence too. So there's a little bit of literature searching to find things that we do in practice, but you have to back up what you do with the evidence. So there's a little bit of lit search going on with that. We had 28 members on our panel from throughout the world. We did it as conference calls. So I was up at the crack of dawn at 6 a.m. because in my time zone here, compared to Australia, who was doing it at 8:30 at night. So it was fun. There was one other person from the United States that was a physical therapist, and she was out from the Midwest, and one other nurse that was on the panel, and he was from Italy. So it was fun to hear everybody's accents. I was relieved to know it was all in English, so I didn't have to go through interpreters, but we really went through a lot of information. I mean, if you think about the care of a brain injury patient from the acute care setting through inpatient rehab, through the outpatient setting to what they need at home, and all the interventions and skills and education needs and what training staff would need and what tools they would need to have at home. We went through everything.
And Maureen, that would be irrespective of the country, right? Because this is global work.
This was global. So the World Health Organization was looking at what intervention skills, medications need to be available. So the hope is that governments will adopt these recommendations and develop their programming based on that, because this is the World Health Organization recommendation for these interventions. So, I mean, to give falls as an example, we went through that, and just to say that we recommended helmets for people who've had flaps. I mean, they don't have anything to protect their head, but that may not be provided.
Would that be like cranial flaps? Is that what you're talking about, Maureen?
Yeah, cranial flaps. Yes. So there's nothing there to protect their skull. And that's not necessarily uncommon around the world to have injuries like that, and to be able to have that with the wars and everything going on. We recommended fall mats, and Pat, I know she loves fall mats and protectors. That's in the evidence to have those available if somebody would fall, to prevent the injury. So to have these things available to their facilities and to their patients, and things that kind of hit my thing, just to think about, they might need a bedside commode, or, toileting strategies, or they may need to know the skill of how to do a bowel program. If somebody has an uninhibited bowel and is incontinent in the bowel, they may need to schedule and do a routine. So going through those skills was important to have, but this was through from cognitive evals to medications, from occupational therapy recommendation, vision, dysphagia screenings. It was everything. It was very inclusive of the skills that are provided by rehabilitation professionals.
And it's so complex, traumatic brain injury management, because it depends on the extent of cognitive impairment, the physical impairment, their ability to be able to communicate, and it can be a wide range of severity and disability. So I'm just sure that was really fascinating work to be able to bring people together from all over the world to see what should be the core central recommendations for any country, no matter where there are people who are having traumatic brain injury. And I believe it was across all age groups. Is that right, Maureen?
Yes, it was across all age groups, and we divided the level of injury into mild, moderate, and severe too. So you'll have recommendations for each level of injury as well.
And what's the next steps for that great work that you are doing?
They're finishing up the peer review piece of the interventions that we have chosen. So we had to come to a consensus, our group, our panel. So as we've come to a consensus, now it's going out to folks who are not on our panels to do a Delphi survey. So they are looking through all the interventions we have recommended and seeing if they agree. Then the next step is they'll bring it back to us to say if there's other things that we need to discuss based on that peer review. And after that, I believe it starts to get published.
Well, that is so exciting.
I know. I am
And
excited.
I know. And so, and I would just like to make sure that everyone realizes is that this is an appointment that you got through the Association of Rehabilitation Nurses, what it means to be part of your professional organization, opportunities to be able to get to serve any way that we can, whether it's local, state, national, or international levels. But and thank goodness you said yes. So that's it, like that's me. so and to be recognized for that. But I know that this is so important because this is your ability to be able to shape care around the world, given this worldwide need for traumatic brain injury. I think it also helps to share the United States dominance in traumatic brain injury. I mean, I've been a rehab nurse long enough that, when they actually started TBI, I mean, it used to be in the 80s that traumatic brain injury patients didn't survive. And we had to start all of that clinical guidelines. I know you remember that as well. Boy, haven't we come a long way.
Oh, yeah. And medications have come a long way. No longer do you sedate. We are working on medications to promote the dopamine and wake them up, because if you get somebody who thinks more clear, then they're going to be able to participate in therapy and be safer. So it's not all about sedating them, and it's working with them and working on their cognition and improving their cognition in any way that we can.
Yeah, absolutely. And, I really applaud your efforts too on reducing falls and fall injuries with this population, because you know what, ladies and gentlemen, as you get to listen to what Maureen's been able to accomplish at not just at her level, at her organization, Dodd Rehabilitation Center, but also nationally and globally, traumatic brain injury patients is so important to protect from falls because you don't want them to hit their head again. That's going to result in even greater loss of function and possibly loss of life. So we have to do everything we can to be able to prevent falls and protect them from injury and protecting that head. That's the floor mats and the helmets. So Maureen and I are advocates for you to integrate injury reduction strategies into your fall prevention programs. And, Maureen, traumatic brain injury is one population that we do want to protect in a very different way because of how vulnerable they are. So as we close and sharing with our audience today, we'd love to hear from you about your vision for fall and fall injury prevention.
Being on the World Health Organization kind of gave me a unique view to think about how governments will utilize this information. And even our programs here in the States to be able to utilize this information to provide programs that will not only care for the brain injury patients, but help with their caregivers and to help prevent future brain injuries, as you said. And then how this works through the continuum of care and how important it is to have rehabilitation and the worth that it is in providing care to the patients. The World Health Organization recommends such things that we take for granted here in the States as basics, medications, nutrition recommendations, helmets, toileting supplies. So having those things listed in their recommendations is key to getting governments to recognize the needs, especially in our third world countries where money is limited. So they have to put their money where things are most needed. So I also hope as the evidence evolves that this tool will emerge and along with the evidence, and we'll continue to prevent falls and we'll continue to prevent brain injuries and care for our patients in the best way possible.
Thank you so much for sharing your vision with everybody, Maureen, because we together are so committed to doing all that we can to be able to protect everyone from fall and fall-related injuries, but realizing that there are some populations that are more vulnerable than others. where,
Mhm.
one more fall could be the loss of function or loss of life that's even more severe. So I know that everyone's going to join us and looking forward to the documentation. I hope, Maureen, that you'll let us all know when it becomes a public document that can be shared. We'll share that through Curbell Medical Incorporated as a resource for the entire world that's going to view this podcast, but also to everybody else. So as we close, Maureen, I just want to say to you, congratulations on all of your achievements. Congratulations for all of your recognition, for becoming a fellow in the Association of Rehabilitation Nurses. The entire world thanks you for the service that you've done, all that you've given to rehabilitation nursing to serve at a national level on top of everything else that you do within your organization, knowing your legacy of service. And for spending time with us today to be able to give some guidance and share your vision with the world. Is there anything else you'd like to just say in closing, Maureen?
I want to just say thank you, Pat, for giving me this opportunity to talk. And it's such a joy to always hang out with you for a little while. And
Thank you.
I hope people get some benefit out of this.
Oh, I know they will, Maureen. Absolutely. Just like I have benefited so much from being able to learn and practice with you over the years and to serve at a national level and influence policy. Because you know what, ladies and gentlemen, this kind of work is what influences policy. We influence point of care as clinicians, but when you actually get to be on the world stage, you're now influencing policy, which will trickle down to the point of care around the world. So again, congratulations, Maureen. Can't thank you enough for being with me today. And I just know everyone's going to enjoy meeting you virtually through the podcast. Thank you so much, Maureen. Have a great day.
Thank you for listening to Care Team Conversation Podcast, sponsored by Curbell Medical. A special thanks to our guest, Maureen Musto. We greatly appreciated you sharing your journey as rehabilitation clinical nurse specialist and your expertise in traumatic brain injury. Thanks to our wonderful host and patient safety expert, Dr. Patricia Quigley. For more information about Maureen Musto and her work with the World Health Organization, Association of Rehabilitation Nurses, and Ohio State Dodd Rehabilitation Hospital, please see the links in the show notes. For more information about Curbell Medical and our innovative products, please visit curbellmedical.com. You will be able to find this and future podcasts on the Curbell Medical website or wherever you listen to your favorite shows.